I'm thrilled to be back with you today to do an interview with Dr. Eddie Jones of Perfect Alignment Chiropractic here in Little Rock, Arkansas. You're going to hear from him in just a moment, but the topic today is really to talk about frozen shoulder, how this particular technique of chiropractic can help and alleviate and ultimately heal the frozen shoulder phenomenon that happens to many of us that have had mastectomies after breast cancer. I personally went through a very extended, painful time of about 18 months before I found Dr. Eddie and had actually tried a number of other methodologies that helped in some ways, but did not ever fully alleviate the pain I was going through from the frozen shoulder, or nor did it heal it. So I really want to share this information with you and introduce you to Dr. Eddie. If you happen not to be in the Little Rock market, that's totally cool. He's going to give you some resources for finding other chiropractors who practice this methodology that he used on me that worked. And this was the first thing that worked in 18 months since I'd had my double mastectomy. So I'm super excited to introduce you to him and to hear from him about what it is he does that works and why. And he's going to show us some different things on the screen. So for those of you that haven't met me, I'm JuliAnne Murphy. This page, if you're seeing this on Facebook, the page you're seeing it on is called Living Out Loud After Breast Cancer. It's just under my name. I'm a double mastectomy, metastatic breast cancer survivor, now thriver. Thankfully, I've lived beyond what they had projected and have been cancer-free for some time. So I'm super blessed, and you can read more about that story, about my whole journey on my blog at juliannmurphy.com/blog, and go to the Unbridled Woman section. What I do now, and I do this for free, is put together interviews and resources and things like that to really give back to other women like me that are going through breast cancer, either as a current patient or have come out of it and are kind of wondering what's next, kind of rebuilding your life, which is a big thing that happens once you've come out of a cancer experience. So that's what this Facebook page is all about. For those of you that are seeing this on YouTube, you'll see I've got a number of videos that have been out now for over the past few months and years, and even way before I had breast cancer. So I am super excited to be sharing with you today, and this is yet another of those interviews and resources for you. So take a look at this, and at the end, we'll talk a little bit more. See you in just a moment. So let's just jump into the questions.
Okay.
So let's do an intro first of you.
Okay.
So for those of you that have not met Dr. Eddie Jones with Perfect Alignment here in Perfect Alignment Chiropractic here in Little Rock, do you prefer people to call you Dr. Eddie or Dr. Jones?
Usually Dr. Eddie.
Okay, awesome.
But yeah, I'm easy either way.
Okay. How long? So as an intro, how long have you been in chiropractic? How long have you had Perfect Alignment? Give us a little background on that.
I actually opened up this location. Well, I didn't open up this location. I actually purchased this from a chiropractor that had its practice here back in July of 2002. So I've been doing
wow.
years now.
Quite some time. Okay,
Yeah.
Very good. So kind of a staple then here in the Hillcrest area, Little Rock. Yeah. Okay, very good. All right, so let me just give a little bit of a background as to how we met, which was I had kind of come to my wit's end with my own frozen shoulder experience after having a double mastectomy, as you're aware, and was looking actually at that point because I'd seen a couple of other chiropractors and had mentioned to somebody online that I was looking for an orthopod to try to figure out how to deal with some of the pain issues I was having. And it was in one of my women's groups online on Facebook, and quite a large one, like 8,000 plus members here locally. And one of the women said, "Hey, you really need to go see Dr. Eddie at Perfect Alignment Chiropractic." And my response was, "Thank you. I've already seen 2 chiropractors. They didn't help me at all. And so I'm really needing to look for something different, another option." And while I'm a huge believer in chiropractic, it just didn't work for frozen shoulder for me. And she said, "I have had the exact same issue. I had a mastectomy. I've had frozen shoulder, and he fixed me in a number of visits." And I was like, "What? Okay, hang on. What does he do different?" And then that's, of course, how I made the call and met you and started the process. And what you and I have worked on together has been so successful in such a short amount of time. I really want to spread the word, especially for other women that go through a single or double mastectomy and suffer with this, because I suffered for and tried a million different things in 18 months until I found you, and spent a lot of time and money that people don't have to. And I feel like what you offer is really the ticket for women that are suffering from this type of pain. So let's talk about, do you want to share your screen first? We've got a number of questions we want to get through, but I really want to talk about first what exactly happens to the shoulder that causes this phenomenon called frozen shoulder.
Sure. I'll share it and then go back to
Sure.
the video because I'm going to demonstrate a little bit too.
Okay, sounds good.
So let me.
So we're doing this on Zoom and you're the host, so you should be able to just share on over. Yeah, there you go. Awesome.
Okay, so your rotator cuff is actually made up of 4 different muscles. If you're looking at someone's back, their shoulder blade be on the right here. This upper muscle on top of the shoulder blade is the supraspinatus. The muscle below that is the infraspinatus. And then you've got the teres minor right here.
Okay.
Those basically rotate the shoulder out.
Okay.
Then if you look at underneath the shoulder blade, you have what's called the subscapularis.
Okay.
It's the one that rotates the shoulder in. It's actually the strongest one of the rotator cuff muscles.
And when you say rotates the shoulder in, meaning it pulls it in like this.
Yeah. So let me go back to here.
Okay.
So when you rotate in, rotate out. So when you rotate in, that subscapularis, rotate out, that's the other 3, supraspinatus, spinatus.
Okay.
Yeah. And so what happens is the most common cause of rotate or of frozen shoulder is actually injury to the rotator cuff. Okay. So when you injure that muscle, it tightens up to protect itself. That's your body's natural response. But when it tightens up, it rotates that shoulder forward because it's staying contracted.
Okay.
So if you hold your arms out and you rotate your thumbs in or thumbs down and then try to raise your arms, it stops. You cannot do it because the position it puts the shoulder in. If you rotate out, it comes right up. So most of the time, and the same thing works for going down. If you've got the thumbs down, drops right down, rotate out. See, now you can't go down.
Right. Okay.
So most of the time it's subscapularis. The shoulder rolls forward. And in fact, when you're looking in the mirror, a lot of times you'll see one shoulder is rolled.
And that was the case when I came to you. I was so frustrated because this shoulder, the right shoulder, was forward. And even then when I was trying to work out and get back into exercise, it looked wonky in the mirror when I faced the mirror. And I was like, why can't I get this to kind of go back? And that was part of frozen shoulder.
Yes. And that's because that muscle was spasmed. It was keeping it in that position. So now because it's in this position, every time you do your daily activities and move around, instead of it moving freely, it's putting increased stress on that joint. The increased stress to the joint causes inflammation. Inflammation can cause scar tissue to form. The scar tissue forms around that joint capsule and tightens it up so that eventually you can't move it at all. You don't have any range of motion.
Right. Okay. Okay. Thank you. So, and why is it then that frozen shoulder is so painful? Is it because just of the restriction and then what happens to scar tissue?
Well, it's both. Mostly it's the inflammation, because that inflammation puts pressure on those nerves in the muscles in the joint, and it just causes severe pain. Now, also, again, when you try to move and it doesn't move, then you're again putting more stress, more irritation, which causes more pain.
So it's kind of a cycle.
Yeah.
What happens? Okay.
Yeah.
All right.
And it just slowly gets worse.
Okay. So I explained my situation that when I've been to 2 other chiropractors and the typical kind of crack your back thing they'd done, which I've had all my life, did not work at all for me in this situation with frozen shoulder. So what type of chiropractic do you do that can specifically treat frozen shoulder, and how is it different from that kind of methodology?
Okay. The technique I mostly use is called Corin specific technique, or KST. And it's kind of a holistic approach to chiropractic, and it's more focused on analyzing your body and seeing what it specifically needs. So
Okay.
when a person comes in and I analyze it, I'm looking for what specific that body needs to help it function better. Whereas a lot of chiropractic techniques are just focused on the joint, or they're just focused, again, some techniques focus just on upper cervical, some on lower. So yeah, there's a lot of different chiropractic techniques out there.
Okay.
And part of that is because everybody's a little different. So you got to
Right.
find a technique that works best for you.
Okay. So it's called KST.
Yes. Core
KST.
specific technique. And here, let me share my screen again.
Okay. Yeah. It would probably be helpful to see it because most people.
So that's
Corin.
it there. Yeah.
Corin.
Yep.
Okay. Corin specific technique. Okay. I've never heard of it. Okay.
Yep.
And so in the chiropractic world, those that know this technique refer to it as KST. Is that so? That's an industry term, more or less.
Yeah. Yeah. If
Okay.
you can actually go on to YouTube and type in KST or Corin specific technique, and you'll see several different videos of different doctors that use this technique.
Okay.
And one of the things we use with the technique is an instrument that's called the arthrostem, and it just gives little taps
Mhm.
to help remove that interference to the nervous system.
So it's funny you bring that up. It looks like a little small gun, almost like a little clicker thing. Well, I sent my husband to you, as you know, 2 or 3 months ago for a migraine, which he's had on and off forever. And I said, you just need to go. And so he came and saw you, and he's been to another chiropractor before, kind of crack your back type guy person. And you worked with him, and in one visit, everything was cool. And he came back and he said, I can't even really explain what he did. And I said, it doesn't matter. All that matters is that it works. And I would say the same for frozen shoulder. I can't even really explain what it is you do, but I know you use that little thing and it works. So yeah. Okay. So if someone doesn't live in Little Rock, because clearly you're here in the Little Rock, Arkansas market, you've been here for some time, you have a very busy chiropractic office. How would they go about locating a chiropractor that does this KST, or the Corin specific technique?
If they'll go to that website, corinspecifictechnique.com.
Okay.
On the top, there's a little tab that says directory.
Okay.
Click on that. You enter in your zip code, and it'll give you the closest chiropractors that have learned this technique. Okay. Now, I recommend that when you find someone, call them and actually ask them if they actually use it, because just because they learned it doesn't mean they actually use it every day.
Yeah. Okay. Got it. Okay. That's great. Okay. So in addition to chiropractic, because let me just recount my experience. So I came to see you. I don't remember exactly what month it was. This happens to be September. I think it was like in April, maybe. And you told me at the time, maybe we would plan on 5 more, maybe 4, maybe 6 visits, depending. I didn't believe you, to be honest, because I was like, nothing else has worked at all, first of all. And second of all, not that fast. So, but it really was that. And it has helped so much that I've kind of hit a plateau and went for a while. And then some other muscles have kind of reemerged, I guess you could say. And now we're working on that. But in addition to chiropractic, when you work with somebody with frozen shoulder, are there other kind of adjunctive care or other people that you recommend they see to kind of release that?
Yes. If there's scar tissue involved, one of the best ways to deal with that is find a massage therapist that does some type of myofascial release technique.
Okay.
That's how you spell it right there.
Okay. The funky
because
word.
That's what that technique does, is it helps break up the scar tissue so that you can get that range of motion back. Because all it does is when it breaks those scar tissue fibers, your body just reabsorbs those fibers. Now, it's not a feel-good technique because you're breaking.
It's not super relaxing, but it's not painful. Yeah. I will say it's not painful.
It is not a relaxing massage technique, but it breaks up that scar tissue so that your body can reabsorb that scar tissue and you can free up that joint.
Okay. So myofascial release.
Myofascial release.
And it's usually a massage or a masseuse or physical therapist that has been trained in that specific
if you can find someone who works with sports injuries, that's great, because that means they do it all the time. Because typically with sports injuries, you get scar tissue, and that needs to be broken up so that athlete can go back out there and function the way we're supposed to.
Okay. Very interesting to me, honestly, Dr. Eddie, that someone who I've always been super active, but until I had the double mastectomy and then developed this frozen shoulder, I had heard of this, but I clearly am not a serious athlete, so I hadn't had the need for it. And I didn't really fully understand what it was. But I will say, from a layman's terms, because when you educated me and said, here's somebody, go and see them, kind of, and you really have to experience it. I've had a ton of massage over the years, and it's not what you would think of your typical, but the manipulation is very slow, and from kind of the receiver's point of view. So and it's getting into what exactly is the myofascial. Can you tell us what that is to help understand?
Well, the fascia is basically the covering of your muscles.
Okay.
And so when you injure a muscle, you get little tears in that fascia. The
Okay.
tears heal with scar tissue. So you get these little fibers that come along and they stick it together to heal it.
Okay.
The problem is those fibers don't just come in there and lay in a nice uniform manner. They stick everywhere. They're all in different directions, and they can actually, if you got two muscles that lay on top of each other, when you normally move, those muscles will slide across each other. It can actually stick those muscles together. So now when you try to move, it pulls both muscles and decreases that range of motion.
Right.
So with the myofascial, again, there's a lot of different techniques. One of the most I'm most familiar with is where they'll let me go back to this so people can see a little better. So basically, like if I was doing my bicep muscle here, you shorten the muscle, you put tractions along the muscle fiber, and then run it through its range of motion as you slide along those fibers. So it leaves the scar tissue that's running along the muscle fibers, but it breaks up any scar tissue that's at odd angles to that, and allows you to, again, still keep the strength of the muscle, but not decrease range of motion.
Okay. Yeah. So again, on the receiver, and thanks for that explanation, because I think it helps. As you know, with my frozen shoulder experience, I had that impacted where the two muscles were stuck, and it was very painful. And I couldn't, even as we worked together, and then you recommended the other gal that I worked with a little bit, just in just several visits, it wasn't a ton. Really did release. And she worked in a weird way that, to me, a typical massage kind of has your typical methods of how they, manipulate the skin. And this usually was kind of going against the grain, if you will, to get to that level of the fascia. So super interesting. And it really worked for me. So I'm now a huge proponent, which is why I wanted to do this interview and share some of this with other women, especially that have gone through this. Okay. So let's go to our next question. How long might someone that has frozen shoulder expect to be treated before they feel better? In my case, it was 4 or 5 times. And then I kind of plateaued for a while, and then we've had some other things emerge. But is that typical?
It is. It's fairly typical. Again, it depends on how long it's been out of place,
right?
How weak the area is. Is there any degeneration in the area? How healthy the person is. The healthier the person is, the faster their body's going to respond.
Sure. Okay.
I mean, that's why I tell all my patients, if you want to speed up the process, 2 biggest things you can do: eat right and exercise.
Right.
Because the healthier you are, your body is a self-healing, self-regulating organism. But you got to give it what it needs to heal. And so, you're doing the right things, it responds much, much faster.
Yeah. Okay. And in my case, just to again recount, it had been almost 18 months since I'd had the double mastectomy when I came to see you. And I was feeling better, actually, even after the initial treatment you gave me. Within 3, for sure, I was feeling so much different with range of motion. I mean, now I can do this with both arms, whereas the right one for me was the one that had the major issue. Even though I'd had the double mastectomy, it was kind of interesting to me that the right was the one that had the impact. So for me, it really within very few visits. So I will say to anybody out there, the other things I had tried were physical therapy for 3 months, kind of your typical physical therapy. I'd done just straight massage for months, like 6-9 months type thing. I'd done all the exercises that I was given from the hospital, from the oncologist, and still was having, I'd done some yoga, and still with all of that stuff, I'd done acupuncture, all of them served in some way, but they never fully got to the root of what was happening. And it was
Right.
really only working with you with this KST, Corin specific technique, and then the myofascial release massage. And again, minimal visits, shocking to me. So that's been to me a huge, huge thing. Can somebody that has frozen shoulder ever get back to kind of where they were before? Is that even a possibility?
Absolutely.
Okay.
Absolutely. But it takes work.
Right.
Again, you can do the things to help free it up, get that full range of motion back in there.
Mhm.
But again, because you injured it, you weakened it. So you've got to strengthen it back up, and
Mhm.
then you've got to maintain that strength. Because that happens. I get a lot of patients that we adjust them, we get them feeling better, they give them exercises so we get the area stronger. And as soon as they start feeling good, they stop doing their exercises.
Yeah. Right.
And
I've
then
been guilty of that. I'll have to say, yeah, because you
and
feel
then
better, and then you're like, well, I mean, I'm back
yeah,
to kind of normal, and then it kind of,
exactly. A year later, because they're not exercising that muscle, it slowly gets weaker again. And then they go and put a lot of stress on that weak muscle, and then they're back where they were.
okay,
So you've got to realize that you've got to maintain. Now, you don't have to do the same intensity to get it one that it took to get it strong,
okay,
but you still have to do those exercises to keep it
like
strong.
2, 3 times a week, or it just depends on the
Yeah,
person.
typically twice a week. Now,
Okay.
when you're trying to get it strong, you've got to do it 4 or
More,
5
yeah,
times.
it's more, yeah.
But to maintain it twice a week,
Okay.
we'll maintain it.
Okay, I need to make a note for that for myself.
Yeah.
I do enough other activity. I do yoga once a week and then bar 3 times a week. So I'm doing enough other things that I feel like keep it elastic.
Yeah.
But there's some movements that you taught me that I don't do on a regular basis that I probably need to go back to. So thank you for that. Here in Little Rock, how can somebody get in touch with you? What's the best way for them to learn about you and all that kind of thing?
Yeah, you can. In fact, I forgot to do that. Hold on just a moment.
Take your time.
So my office is at 205 North Van Buren Street. My office number is 501-223-2345. And then I forgot put my website on there.
I'll put it on on the end slide.
Yeah, perfectalignmentchiropractic.com.
.com, right? Okay, very good. And for the most part, you do accept regular health insurance depending
Yeah.
on what their plan, which I know I was able to take advantage of, which I was thrilled about. So that's really reasonable and helps a lot of people as well. So
Most chiropractic or most insurance cover chiropractic.
yeah,
Now, depending on your plan, depends on how many visits they allow and how
right.
much your deductible is and things like that.
Right. Okay, good. Great. Well, this has been super helpful. Thank you so much, Dr. Eddy, for your time and for explaining this process, what frozen shoulder is and how it works and the method that you do. I just want to express that I'm super grateful that to have been referred to you, to have had another woman that had been through the same thing. And that's what I'm trying to do here, is just to share so that people can find you and can discover this method that I'd never heard of. Because I feel, especially for women with breast cancer, we've been through so much. And then it's frankly kind of an insult to then get frozen shoulder. And you're like, how does this happen? I mean, come on, haven't I dealt with enough? So I'm really
Right.
grateful to professionals like you who are taking care of women like us that are really helping get past the pain and get back to, a different life, a new life. So I just want to say thank you for that.
That's why I love my job, is I'm
Yeah.
making people feel better all day.
Yeah.
If I could just figure out how to not to deal with the paperwork, I'd have the best job in the world.
Yeah. Awesome. Very good. All right, good. Well, thank you so much. I'll make sure to put your website on the ending screen. And for those of you that have any questions, you're welcome to, people can call you or contact you through the website and just ask
Call me,
directly.
email me through the website.
Mhm.
Yeah,
Okay.
I love talking to people about this. And again, I'll let you know if you come in, whether I think I can help you or not.
Yeah.
Um,
You're very straightforward and
Yeah.
approachable. So, okay, great. All right. Well, thank you so much. This has been super helpful. I appreciate it. And we appreciate all the information. So that was a great interview, wasn't it? I'm really grateful to Dr. Eddy for the time he gave me for having this conversation. And I'm hopeful that it's been helpful to you as you are going through or have a loved one that's going through the breast cancer journey and maybe has experienced or is now experiencing frozen shoulder. hopefully you can find some relief from that pain via finding somebody that does this KST method and some of that myofascial, fun word, release. So if you need more information about me or about my cancer blog that I wrote during chemo and during the aftermath of all that, you can go to juliannemurphy.com/blog and choose Unbridled Woman. There's some other resources there as well. I'm going to put on the screen here below Dr. Eddie at Perfect Alignment. His full name is Dr. Eddie Jones, though he goes by Dr. Eddie, at perfectalignmentchiropractic.com, and you can see that below here. You can contact him there. He gave you the phone number earlier. That's in the video. So for those of you locally in Arkansas or in the Little Rock market, if you can't find anybody else that does this KST, you may want to travel to see him. It's definitely worth it. It's amazing how much he really changed my life in terms of helping me get rid of that pain and getting back to full mobility, which for me has been a huge deal. So thank you again for being with us. I'm super happy that you were able to join us and look forward to seeing you soon on one of my future videos. JuliAnneMurphy.com. JuliAnne Murphy. See you soon.